Hello friends, I'm Dr. Krishna. I'm one of the neuropsychiatrists working at Tender Minds Clinic. Today I'm going to talk about depression. I think people know about something about depression, but they are not very familiar what is depression is. So I'm going to give you some understanding of what is depression is. Depression is some set of symptoms and they are present. We call them as having depression. And it can be classified as mild, moderate and severe, but there are some core symptoms which I would like to illustrate. And some of the core symptoms are, first is what we always call as mood. When as a psychiatrist or a neuropsychiatrist, when they ask you, how is your mood? We usually ask is how they are feeling now or how they are feeling for many days. So when their feeling is like low, then we call them as having low mood. Not a depression, but a low. Similarly, if a person is having a low mood for a long period of time, and along with it, if they have other symptoms, then we call them as depression. So, what else can be? Something like feeling like very becoming easily irritable, anxious, worried for small things, lack of interest in going out, no interest in seeing movies, no interest in making some tea, coffee. Sometimes even depression can be associated with the weakness, what we call as fatigue. You might have seen some people becoming very weak. That will happen while they are in depression. But they genuinely feel very weak in spite of having a good physical. We call it as easy fatigue. Then other symptoms is like thinking negatively. Small things can make them feel negative in themselves or low self-esteem. These are some of the symptoms. Along with that, there are certain classical symptoms. They are what we call it as biological symptoms of depression. One of the biological symptoms what is sleep. When we are low, we don't get sleep, isn't it? So if it is for a prolonged period like 10-15 days or more, with no sleep or proper sleep, what we call it as sleep disturbance. They might have a problem in initiation of sleep, or if they are sleeping, they wake up in very in the morning, which they never tend to, or they frequently wake up at night. And after getting up, they might not feel refreshed. If you feel refreshed, you are normal. If you don't feel refreshed, then you are might be suffering from depression. They might also have weight gain or weight loss because they might not tend to eat less. Or some people, when they are so depressed, they might tend to eat more. They tend to eat more, then they are having gain weight. So always there is a big disturbance will be there. Either they lose weight or some people gain weight. They tend to have some sexual problems, especially in men. Loss of interest will be there. They can't involve in sexual activities. So we call it as loss of libido. Same thing happens with even with women, not interested in sex at all. So these are biological symptoms of depression. Along with the biological symptoms, there are other symptoms, physical symptoms. That is something like what we call it as anxiety. So anxiety is just a fear, unknown fear. It might be there in your body, something like feeling restless, not able to relax yourself, always feel restless, want to go from one place to another, unable to relax yourself. So this is what we call as anxiety. You might also feel like some people will feel panicky. They might have panic attacks. Some people feel restless and they might pass on as when they are severely depressed. So anxiety is usually associated with depression. So some people tend to have more anxiety, some people may not tend to have anxiety at all in depression. So it depends on each individual. Along with the anxiety, when people are very depressed, one of the other symptoms which we always tend to ask is, how are you feeling in yourself, or do you want to harm yourself, or do you want to kill yourself? So these are some questions we ask. Why we ask is most of the people who are severely depressed also tend to lose interest in life, and so they want to harm them or they want to take their life out. So it depends. When they are in the milder form, they just feel that it's better to die rather than live like this. Some people tend to feel like it's better to die, so they plan ahead. They might have planned to how to kill themselves. They might go into Google and search for various ways to kill themselves. So these are some of the symptoms of depression. If you in any of this, if you have at least 5 symptoms or more, According to DSM, you suffer from depression. So, if you suffer from these symptoms, it's better you see a psychiatrist as soon as possible or any therapist will help a great deal in lessening the depression. Thank you.